So, welcome to the detailed session on the pharmaceutical jellies in the realm of the semi-solid dosage forms. So, jelly represents a fascinating and a versatile category here. So, unlike creams or the ointments, jellies are characterized by their high water content, cooling effect, and a transparent or translucent appearance. So, they are designed for external or internal applications depending upon the formulation. So their smooth texture and the light feel make them suitable for sensitive areas such as mucous membranes, oral cavities, and abaded skins. Over the next few minutes, we will take a deep dive into the science behind the jelly formulation, types, components, evolution, and the clinical relevance. So, what are these jellies? So, jellies are the especially pharmaceutical jellies are the semi-solid preparations wherein one or more active ingredients are dispersed in a gel base here. So this base is formed by hydrating the natural or the synthetic polymers in water. Okay, so the result in a system that holds water within a three-dimensional network here, so creating a substance that is both soothing and effective in drug delivery here. So the jellies are intended primarily for the topical, mucosal or oral use, so providing the localized or the systemic effect. For instance, a lignocaine jelly is used in the dentistry, provides a rapid numbing, while sildenafil oral jelly acts systemically. So their high water content allows the rapid drug release here and enhances the patient comfort, especially in conditions involving irritations, inflammations, or dryness like that. Okay. And next one is the types of jellies. So there are several types of pharmaceutical jellies and they can be classified based on their intended use and the site of application here. So first one is the medicated jellies. They mainly contains the active pharmaceutical ingredients intended for the therapeutic action. So common examples includes anti-inflammatory or antiseptic jellies. So these are used on the mucous membrane or the skin to relieve the symptoms here. And second one is the lubricating jellies. On the other hand, are sterile preparations used in the medical procedures such as rectal examinations, endoscopy, catheterizations. So where smooth passage of the instrument is necessary. Okay, so it's simply for the lubricating purpose. And third one is the oral jellies. So these are somewhat flavored palatable jellies designed to dissolve in the mouth, either for localized effects or for systemic absorptions via the buccal cavity or the GI tract. So the pleasant taste and the easy swallowing make them especially beneficial for pediatric and the geriatric patients. So these are all the various types of the jellies. So let us see the ideal properties of the jellies. So for a jelly to be pharmaceutically acceptable, it must possess some certain ideal properties that ensures the patient comfort, drug stability and the therapeutic efficiency here. So first and foremost is it should have a smooth lump-free texture to ensure the uniform applications and the aesthetic appeal. It should be non-irritant, especially when applied to the sensitive or the inflamed skins. And third one is the spreadability is a crucial parameter here. It should glide easily on the skin or the mucus without leaving a sticky residues. So stability is the another key factor. The jelly should maintain its integrity under the different temperatures and the humidity conditions and remains microbiologically stable throughout its shelf life. Okay, so for certain applications like buccal jellies, bioadhesiveness is also the desired one factor here. So the jellies remains in a place for a sufficient drug absorption. So these properties are all largely influenced by the formulation, ingredients and the methods of preparation. Okay, so all these are all the various key properties required for the jellies. And next one is the composition of the jellies. So the formulation of a jellies involves in a precise composition of the ingredients that together creates a stable, effective and a acceptable product here. At its core, the active drug provides the therapeutic benefits and must be compatible with the rest of the formulation here. So the gelling agents such as gelatin, pectin, sodium alginate, carbapoles, tragacanth is responsible for forming the gel structure by absorbing water and swelling. Okay, and the solvents typically purified water act as in a dispersion media and is the largest component by volume here. So to prevent the microbial contamination, preservatives like methyl parabens or the propyl parabens are added. In oral jellies, flavoring agents, sweeteners like sorbitol, colorants improves palatability and appearance. Okay, sometimes the buffers or pH adjusters are also used to maintain the pH that ensures both the stability of the drug and the comfort on applications. Okay, so the interaction among all these components must be carefully controlled to ensure the homogeneity and the efficacy and the safety here. Okay, so this is simply the composition of the jellies. And next one is the method of formulation. So the process of preparing a jelly begins with hydrating the gelling agent first. So depending upon the polymers used, so this step may involve dispersing the gelling agent in a cold or hot water. So often under conditions like a continuous stirring to avoid the clumping. So once a uniform gel base is formed, other water soluble ingredients such as preservatives, sweeteners and buffers are added. So after allowing the gel to cool to the room temperature here, especially important if the gelling agent is a temperature sensitive one, so the active ingredient that is the drug is incorporated. Okay, so the drug may needed to be pre-dissolved or suspended depending upon its solubility. Okay, so flavors and colors are also added last to preserve their stability here. So the final jelly is deaerated to remove air bubbles and then fill into a tubes or jars. Okay, so under aseptic conditions, so all this procedure should be conducted under aseptic conditions only. So if we use for mucosal or the surgical procedures, so the jelly must be sterilized or prepared in a sterile environment here. So proper control of mixing time, pH and temperature during this process is crucial for producing a high quality product here. Okay, and next one is the evaluation of the jellies. So after formulation, the pharmaceutical jellies undergo rigorous quality control tests to ensure their safety, efficacy and the consistency here. We have to check the product quality by conducting various quality control tests like appearance test, pH measurement, viscosity and spreadability measurements, drug content uniformity, microbial testing, stability studies. So we have to conduct all these tests. First start with appearance. So appearance is the first and the most basic test. So the jellies must be transparent or the uniformly colored, free from bubbles or foreign particles, like that we have to check in this test. And next one is the pH measurement. So it mainly ensures that the jelly is compatible with the skin and the mucous membrane and does not causes any irritation. Okay, like that we have to check. And next one is viscosity and spreadability. So it is typically ranges from 5.5 to 7.5. Viscosity and the spreadability are tested using rheometers or the viscometers and spreading equipments to assess how the jelly behaves under pressure and how easily it can be applied, like that we have to check. And next one is the drug content uniformity. It mainly checks whether the active ingredient is evenly distributed throughout the preparation. And microbial testing ensures the product is sterile or within the acceptable microbial limit, especially important for jellies used on the broken skin or the mucous membrane here. Finally, stability studies under various conditions helps predict the product shelf life, and inform proper packing and storing conditions. Okay. Advantages of the jellies. So the pharmaceutical jellies offers numerous advantages over other dosage forms, particularly when comfort, ease of use, and targeted delivery are important here. So their high water content gives a cooling and a soothing effect upon application, which is practically helpful in conditions like burns, ulcers, or rashes. So they spreads easily, leaves a minimum residual, and are non-greasy, so which improves a patient compliance here. Okay, so oral jellies are easy to administer without water, so making them a great choice for the children and the elder patients who may have difficulty swallowing tablets. Okay, so at that time it is a wonderful option for the patients like the children's, that is pediatric patients. Okay, so the rapid drug release from the hydrated matrix allows the faster onset of action, especially for the drugs intended for local effects. Okay, so moreover, jellies can be formulated with a wide variety of drugs and adapted for various routes of administrations, including topical, oral, rectal, and vaginal use. So all these are all the various advantages of the jellies. Let us see the limitations of the jellies. So despite their benefits, jellies do have certain limitations that must be considered during the formulation and use. Since they are primarily water soluble, so they are more susceptible to the microbial contamination. Okay, and therefore requires an effective preservation and a proper storage here. So they must dry out or shrink over time, so especially when the container is not sealed properly or stored under low humidity. So some gelling agents are sensitive to pH and temperatures, so which can be leads to the syneresis, that is the water separation or breakdown of the gelling network. So also certain drugs may not be suitable or soluble in the aqueous systems, so limiting the range of the API that can be used here. Okay, so finally the cosmetic elegance and the patient acceptability can be affected if the jelly feels sticky, smells unpleasant, or lacks a visual clarity. Okay, so all these are the various limitations of the jellies here, and let us see the applications and the examples of the jellies. So jellies are used in the diverse therapeutic areas depending on their composition and the route of delivery here. So for instance, lignocaine jelly is commonly used in the dentistry and the minor surgical procedures for the local anesthesia. Oral jellies such as those containing the sildenafil citrate provides a rapid action in the conditions like erectile dysfunctions and are often favored due to their ease of intake and the quick absorption here. So in gynecology and urology, lubricating jellies facilitates the diagnostic and the surgical procedures. So jellies are also used in the treating oral ulcers, fungal infections, burns, and the vaginal dryness. So they are often combined with the soothing or the healing agents like aloe vera or antiseptics to ensure their action here. So the versatility of the jellies ensures their place in both modern medicines and the traditional the herbal formulations here. So let us see one example for the jelly formulation, that is ectomol jelly. So what is this ectomol means? Ectomol is also known as the ammonium bituminosulfonate. It is a dark and brown thick tar color substance delivered from the sulfonated shale oil. Okay, so it has been used for over a century in dermatology for its anti-inflammatory, antibacterial, and the soothing properties here. So when formulated into a jelly or a gel, it becomes in a convenient semi-solid topical dosage form for applications on the skin here. So the ecthamol jelly is especially valued in treating conditions like boils, eczema, infected wounds, so where it helps draws out infections and reduce the inflammation here. So, what are the properties of this ecthamol jelly? Means the ecthamol possesses several unique properties that make it particularly useful in clinical practices here. So, it is an antibacterial, especially the effective against the gram-positive bacteria, and exhibits a mild fungicidal and the keratolytic actions here. So, it is also having a vasodilatory effect, which provides the blood circulation to the affected area, enhancing the healing process here. So the jelly base provides a cooling and a soothing effect on the applications, and helps retain the moisture, so making it ideal for dry or the inflamed lesions. So one of its hallmark feature is its drawing property, so often used to help localize the infection, such as bringing a boil to a head. Okay, let us see the formulation of the ecthamol jelly. So the formulation of this jelly includes 10 to 20% ecthamol dispersed in the water soluble or a water miscible gel base first. And common gelling agents includes carbapoles, methyl cellulose, or tragacan gums. So the base may also contains a glycerin or a sorbitol as a humectant here, and preservatives like methyl parabens to prevent the microbial growth. Okay, so the process involves dissolving the gelling agent in the water under gentle heat and stirring, and then incorporate the ethanol until a uniform dark brown jelly is obtained. So the pH is often adjusted to the mild acidic or a neutral level for skin compatibility here. So this preparation is then packed in a jars or a tubes with a proper labeling, indicating the external use only. And let us see the clinical uses and the indications here. So the ecthamol jelly is used in a variety of the dermatological and the surgical conditions. So one of the most commonly used is for the treatment of the boils and the abscesses. So where it helps to draw outbursts and reduces the swelling here. So it's also useful in the insect bites, eczema, psoriasis, dermatitis, acne, especially where bacterial colonization is suspended here. So in it provides symptomatic relief from itching, burning, and irritations. So because it's soothing and the occlusive, it also supports the wound healing by keeping the area moist and protected from the further contamination. So let us see the method of application. So ecthamol jellies is usually applied topically in a thin layer over the affected area. In more severe are the infected lesions here. So a thick layer is applied and covered with a gauze dressings, and changed once a twice daily. So the jelly should never be applied to the open deep wounds or the mucous membranes, as it is intended for external use only. So before application, the area should be cleaned and dried properly. The patients are advised to avoid contact with clothing, as the dark colored jelly may stain. Okay, so despite its strong odor and color, it is generally well tolerated and non-irritating for most individuals. Okay, precautions and the side effects of this jelly means, so though ecthamol is generally safe, so there are some precautions to consider. It should not be used on the deep puncture wounds, animal bites, or severely damaged skins unless advised by a physician. So in rare cases, hypersensitivity reactions such as redness, rash, or burning may occur. So long term or repeated use should be monitored to avoid the skin discoloration here. So since it is a tar derivative, there is an minimal systemic absorption, but its use in a pregnant or lactating women should be under medical advice. Okay, so the patient must always read the label instructions and follow the professional guidance during the treatment. So to summarize, the ectomol jelly remains a time-tested and a effective treatment for a range of infected, inflamed, or irritating skin conditions. So its anti-inflammatory, antibacterial, and soothing effects make it an essential item in the dermatological and the minor surgical case. So its ability to draw out the infections reduces the discomfort and promotes the healing continues to make it a proper and an accessible remedy here. So despite its color and odor, the therapeutic benefits of the ectomol jelly outweigh these cosmetic concerns. Okay, so with proper formulation, applications, and the patient education, ectomol jelly provides to be a valuable tool in the pharmacist and the physician arsenal. So, in summary, the pharmaceutical jellies are the semi solid, soothing, and the effective drug delivery systems here. So, the simplicity, patient friendly design, and the versatility make them a popular choice in the modern medicine. So, let's quickly revise with a few Viva style questions. What is the role of the gelling agent in the jellies? So, name two types of the pharmaceutical jellies. So why are the preservatives added to the jelly formulations? So like that we have to focus on the topic. So thank you for watching. For more pharma content, don't forget to like and subscribe to Medi.